I'm Dr. Amir Mahajer, the Educational Chair for the American Osteopathic College of Physical Medicine and Rehabilitation, and today we're going to take a few minutes to talk about musculoskeletal ultrasound as it pertains to intervention. As we know that the cost of advanced imaging such as MRI are skyrocketing, we need to take advantage of the tools that we have in our office. Many of us have ultrasound machines in our office, or in training you're usually trained in physiatry to use musculoskeletal ultrasound for diagnostic as well as interventional techniques. Intervention techniques are diagnostic as well as therapeutic, and today we're going to take a few minutes to talk about that. Advantages of ultrasound is that they're portable and low cost. They use non-ionizing radiation, dynamic image capability, ability to perform immediate exams in comparison to the contralateral side, the other side. And some of the limitations are that it doesn't penetrate through bone. So if you're worried about mets or tumors or other things, you're not going to be able to evaluate that with an ultrasound, and you should go ahead and order the MRI. The total aggregate direct cost in 2011 dollars found that spine imaging increased from $132 million to $251 million, and for arthritis and joint pain it increased even more, from $185 million to $580 million. Reviewing these MRIs, they found that out of 3,620 studies, that 45% of the primary diagnosis and 30% of all diagnoses could be found using ultrasound rather than MRI. Those savings were estimated to be at $6.9 billion between 2006 and 2020. So now we're going to talk a little bit about the interventional application of ultrasound guided needle placements and how to improve this. In general, you should have a lot of hands-on experience prior to attempting a needle guided placement using ultrasound, because it can be technically challenging. And I recommend the American Osteopathic College of Physical Medicine and Rehabilitation ultrasound course that is specific in both diagnostic and interventional approaches. You can see our website for more details, AOCPMR.org. But in order to begin, you need to know how to handle the probe. So I use the acronym PART, P-A-R-T. So pressure, alignment, rotation, and toggle. When you're doing pressure, you can do sonopalpation to see if it hurts. You can evaluate soft tissue structures, bursitis, fluid beneath the tissues. For alignment, you want to check the image in the center of the screen, so that way for guiding the needle, you're not chasing it outside of the screen. That's never good. Rotation, you want to make sure you evaluate the item in short and long axis for your intervention, and you can either guide the needle in plane, meaning you see the whole length of the needle, or out of plane where you just see a small dot on the screen. And then toggle, you can toggle so you can create the normal angle of incidence, and the best angle of incidence is 90 degrees. So the needle is in plane and at 90 degrees to the probe. So the needle beam angle that what you're attempting is 90 degrees to have the best resolution of your needle and not be confused by anisotropy, which is a whole nother topic. You need to understand all of the artifacts to do with ultrasound. You can use heel-toe to improve that 90-degree angle so you get the great angle of incidence and you're not confused by anisotropy. And in ultrasound, our machines are becoming much more advanced. Soon there's going to be different guiding systems. Some machines already have this to improve the ability to see the needle, to drive the needle safely into targets that you're interested in, and more importantly to avoid targets that you're trying to avoid in interventional ultrasound. Thank you very much.